name is Haley Alverson. I'm a junior nursing student. I'm checking off Stacy for the abdomen, and today is October 23rd.
I, Meredith Moran, hereby give my written and verbal consent to be filmed in the Liberty University Nursing Exam Suites in the Nursing Department at Liberty University as part of the Nurse 210 Adult Health Assessment, Nurse 221 Fundamentals of Nursing course. I understand that in giving my consent to be filmed, I also give permission for the film containing my image to be submitted to a secure YouTube site viewable by the nursing students and instructor of the course. I understand that during the examination of filming, areas of my body will be uncovered, exposed, inspected, palpated, percussed, and auscultated by the student nurse. With the understanding, I give my consent.
Thanks. Okay, I'm Stacey. I'm going to be doing your abdominal assessment today. Can I have your name and date of birth, please?
Meredith Moran, 10/20/93.
Okay, thanks. So go ahead and lay down, and we're going to lift up your shirt just to show here. Okay, so upon inspection, the patient's skin color is light tan with pink undertones. There is a secondary lesion in the form of a lateral scar and some generalized primary lesions in the form of macules. The patient is positive for respirations and negative for any pulsations and negative for peristalsis. The patient has an inverted umbilicus and the patient's contour is flat with no abnormalities. It is bilaterally symmetrical. Now we're going to listen for bowel sounds. Okay, so when auscultating, the patient had about 6 bowel sounds, which is within normal limits between 5 and 35 per minute. There were no venous hums heard over the epigastric or umbilical regions. There were no friction rubs or hums heard over the liver or spleen. And there were no bruits heard over the aortic, renal, iliac arteries, and we're deferring the femoral arteries today found in the groin area. Okay, there are dull sounds heard over the spleen and liver areas, and tympanic sounds heard in the lower quadrants, and tympany heard over the bladder. Okay. I'm going to measure the size of the liver. Okay, and it is within normal limits at 7.5 centimeters. And we're listening over here for the spleen. So can I have you hold your breath and hold your inhale? Okay, you can exhale. Now take a breath, and then I'm going to have you hold your exhale. Okay, so the spleen is in the normal place between the 6th and 10th intercostal spaces. Now we're going to palpate. On light palpation, the muscle resistance is normal. Is there any tenderness? Is there any tenderness down here in the iliac or inguinal region? Okay. On deep palpation, the liver is palpable. It is smooth and it is dense and firm. Can I have you cough for me? Okay, the tip of the liver is sharp, which is within normal limits. The spleen is not palpable, which is normal. The patient's right kidney is palpable. It is small and round and smooth. Now I'm going to come to the left kidney. This kidney is also palpable, and it is small, round, and smooth, and free of any abnormalities. Now for the test, we're going to first do the Blotman test, and there's no palpable masses, no freely movable masses, so she would be negative for Blotman. We're going to do the Iliopsoas test, so I'm going to have you pick up your right leg against my resistance, okay? Was there any pain there? Okay, good. Now the obturator muscle test, so lift your leg up, bend your knee in, and turn it this way. Is there any pain when you do that? Okay, good. And is there any pain after I press in here when I let go? Okay, so the patient is negative for rebound tenderness. We would also check for hernias, so can I have you take a deep breath in and hold it, and then lift your head up? Okay, so the patient shows no signs of hernias. And that concludes your abdominal assessment. Thank you.